Welcome to this explainer. Today, we're doing a total mindset shift when it comes to women's health. We're moving completely away from the anxiety and fear of finding disease, and instead we're going to confidently focus on investing in lifelong wellness and, crucially for many of our viewers, military readiness. We're going to look at health screening not as some tedious chore, but as a deeply empowering tool that lets you serve, live, and thrive with absolute confidence. Let's get right into it.
So here's our roadmap for today. We'll start by busting the "I feel fine" myth, then look at what health screening really means, how our health needs change across different life stages, getting to know your baseline numbers, those targeted age-specific screenings, and finally, how all this ties into the military readiness factor.
All right, Section 1, the "I feel fine" myth. Why wait for symptoms? Doc, I feel totally fine. Do I really need to get screened? We hear this all the time. And honestly, it makes sense, right? When you're actively juggling demanding military duties, a career, and family life, you might wonder why on earth you should carve out precious time to see a doctor when you literally have zero symptoms. It feels totally counterintuitive. If it ain't broke, don't fix it, right?
Well, here's the catch. The dangerous myth is that zero symptoms equals perfect health. But the biological reality? Things like high blood pressure, diabetes, osteoporosis, and even cervical cancer, they can actually progress in the background for years, sometimes decades, without giving you a single ache, pain, or warning sign. Early detection isn't just a medical buzzword, it's literally your strongest, most reliable shield against these completely silent conditions.
Moving on to Section 2. What exactly is health screening? Let's define this protective shield.
So the key thing to understand here is that screening is completely different from a diagnostic visit. When you go in for a diagnosis, you're tracking down an active symptom, like a weird cough or a sharp pain. Screening, on the other hand, is looking for disease before any symptoms ever show up. Think of it like a military early warning radar system. You want to spot that incoming threat when it's miles away, not when it's already knocking at your front door. Finding things early makes treatment so much simpler and the long-term outcomes way better.
We really need to flip the script on this narrative. A lot of folks avoid these appointments because they think, well, if they're testing me, they must expect to find something wrong. But screening is 100% preventative. It's a proactive, empowering way to just confirm your baseline health and keep you well. It's not this scary search for bad news. It's just a routine system check to make sure everything is good to go.
All right, Section 3, Health Across Life Stages. Let's take a chronological journey.
The good news is you don't need every single test at every single age. Your body's needs naturally shift over time. In your young adult years, you're mainly focusing on building those foundational healthy habits to lower future risks. But as you transition into your reproductive years, midlife, and older adulthood, those recommended screenings are going to shift and scale depending on your exact age, your personal history, and your specific risk factors.
Let's zoom in on the reproductive years for a second. Obviously, if you become pregnant, your focus naturally shifts toward maternal care. The big priorities here become strict prenatal care, keeping a close eye on blood pressure, blood sugar screening, getting those recommended maternal vaccines, and dialing in your nutrition. And these aren't just boxes to check. They're the absolute bedrock for the next generation's health, setting up the best possible outcomes for both you and your baby.
On to Section 4, knowing your baseline numbers, your vital stats. Okay, think of these 5 baseline indicators as your body's dashboard. Just like you wouldn't ignore a check engine light or a fuel gauge before heading out on a long mission, you really shouldn't ignore your blood pressure, your blood sugar, your healthy weight, your mental health status, or your vaccination history. Think of this as your personal PMCS, your preventive maintenance checks and services. Knowing these numbers puts you firmly in the driver's seat of your own wellness.
Section 5. Targeted vital screenings. Let's look at some age-specific actions.
Age 25. This is your first major targeted screening benchmark. 25 is when you really need to start discussing cervical cancer screening with your provider. And hey, this isn't just a one-and-done chat. It's a routine conversation you're going to keep actively having all the way up to age 65.
Next up is the Big 40. Hitting 40 means it is absolutely time to proactively start talking with your doctor about breast cancer screening options. Again, getting ahead of the curve here is just paramount for giving yourself the best possible options and outcomes down the line.
And when you hit 45, it's time to add colorectal cancer screening into the mix. Now, this one is highly tailored to your individual family history and your personal risk factors. That's exactly why keeping an open, ongoing dialogue with your provider is so crucial. They're going to guide you on exactly what makes sense for your unique profile.
Now let's talk about the flip side for a minute. We've been focusing on hunting for silent diseases before they show up, but there are certain active warning signs you can never, ever ignore. If you experience abnormal vaginal bleeding, new breast lumps, sudden pelvic pain, unexplained weight loss, or persistent fatigue, you have got to seek medical consultation immediately. Seriously, do not wait for your next annual checkup. These are active flares, and jumping on them early can be a literal lifesaver.
All right, our final section, number 6. The military readiness factor, serving with confidence.
Look, we know balancing demanding military duties with personal health is incredibly tough. It really is. But hear me out on this. Taking time out of your busy schedule for preventive care is not selfish. It is a fundamental, non-negotiable requirement. Preventive care directly supports your well-being, which in turn fuels overall operational mission readiness. You simply cannot serve at your best or support your unit effectively if you're running on empty or ignoring your own baseline health.
So how do we actually stay on track with all of this? It basically boils down to 5 simple steps. First, know your family medical history. It dictates your risk. Second, keep your health records organized. Third, actually listen to and follow your provider's advice. Fourth, keep up with those healthy lifestyle habits. And fifth, our golden rule for today, never ever delay care just because you feel fine.
Because at the end of the day, taking care of your health is quite literally one of the best investments you can make for yourself, your family, and your future. Prioritizing your wellness isn't some tedious chore, it's the highest yield investment out there. It pays massive compounding dividends for your personal longevity, your family's stability, and the long-term success of your career.
Healthy women build healthier families, which in turn build significantly stronger communities and units. Ready today, will tomorrow. Knowledge protects, prevention saves lives. That right there is our ultimate guiding principle. Knowing your numbers, understanding your timeline, and acting proactively. That is exactly how you protect yourself and everyone who relies on you.
As we wrap up this explainer, I want to leave you with something to really think about. Are you truly investing in your preventive readiness today? Think about everything we just covered, from those baseline dashboard numbers to your age-specific screenings. What specific action are you going to take this week to call your doctor, get that screening on the books, and actively protect your future health and readiness? Think about it.